do I need imaging, X-ray, MRI, etc.? Well, I kind of went over that just a second ago, and that is, well, maybe. In some cases, imaging can actually send us in the wrong direction. So I have lots of people that will look at their image and they'll say, oh, I have a degenerative disc disease, or I have, a torn labrum, or whatever it is, according to that. But then when you talk to them and you ask them, you realize that they're not really affected by whatever's torn or by whatever's degenerated and so on. And that it's really something else that's actually bothering them. And that's kind of the key, is our bodies are way more complicated than can just be interpreted on a photo or some type of imaging. There's a lot more that goes into it. As I said earlier, you can have knee pain or hip pain that could be both related to the hip as well as something else that's referring pain to that area. And that's what I see in many, many of my clients, is that they'll be like, yeah, I went to the doctor, they couldn't figure out what was going on. And often what it was is because they're going, oh, well, I have knee pain. And so then they start looking directly at the knee, and then they realize, wait a second, the knee is just one component of that. And it turns out they have back sciatic pain that comes down to their knee, refers down to the knee. And in addition to that, they due to the way they've been moving lately, they've been making some changes in that, and they do have some pathology in the knee as well that's causing pain, and it's a combination. And so instead of just looking at the MRI and saying, oh yeah, we'll scope the knee, and you've got a torn meniscus. Everybody has a freaking torn medial meniscus, right? That doesn't always mean that that's what's causing the issue. So you go in there and you clean it out, and then you go back and you're like, hey, I'm 8 weeks into rehab, I'm 12 weeks into rehab. I have that same pain back in my knee that I had before now that I'm active again. Oh, it's because it turned out that your lumbar spine was agitated and that you had sciatic symptoms referring down to your knee, in addition to having a frayed meniscus, which is exceedingly common as we age, especially.